Mark. I'm going to be your nurse today. I'm just here to perform a head-to-toe assessment on you. Is that okay?
Yes.
Okay, I'm just going to give privacy, perform some hand hygiene, and clean my stethoscope. Okay, and then I'm just going to be looking at your wristband. Can you please state your name and date of birth for me, loudly and clearly?
Anya Arthur. My birthday is April 6, 2010.
Okay, thank you so much. And then can you please tell me what today's date is and where you currently are?
November 21st, 2025. And I'm at your house.
Okay, thank you so much. And then I'm just going to do a general assessment of the patient's overall appearance, checking their appearance, body build, mood, and speech. Patient appears to be a little tired and a bit agitated. Mood is overall, though, a bit calm. Patient's speech is a bit quiet but clear and easy to understand. And body build, patient's a little slouched over, again, matching with the tiredness, but overall appears to be normal. And next, we're going to start the cardiac assessment. Oh, one thing. Now we're going to start the cardiac assessment. I just have a couple of questions to ask you. Have you recently experienced any chest pain or tightness?
No.
Okay, and have you noticed any swelling in your ankles or feet recently?
No.
Okay, and have you recently experienced any shortness of breath?
No.
Okay, thank you so much. And then next, I'm just going to inspect the 5 cardiac areas. Maybe put your arm down for me. Just looking for any lifts or heaves, looking in the intercostal spaces. So starting with the aortic, which is on the only one of the 5 cardiac areas on the right side of the body. Which is at the second intercostal space. The pulmonic, which is on the left side of the body at the second intercostal space. Erb's point, which is at the third intercostal space on the left side of the body. The tricuspid, which is at the 5th intercostal space on the left side of the body. And the mitral, which is also on the 5th intercostal space on the left side of the body at the mid-clavicular line. No lifts or heaves noted. And now I will palpate the intercostal, the 5 cardiac areas, feeling for any thrills or pulsations. No thrills or pulsations noted. And I'm going to palpate the apical pulse as well. Apical pulse is palpable. Next, I'm going to listen with my diaphragm to the 5 cardiac areas, listening for the S1 and the S2. Okay, so aortic, pulmonic, erbs, tricuspid, and mitral. Okay? And then next, I am going to listen with my bell to those 5 cardiac areas again, listening this time for any murmurs. Aortic, pulmonic, erbs, tricuspid, mitral, and no murmurs were heard. Okay, so I have palpated, I have auscultated. Oh, and then the next thing that I will do is I'm going to measure the apical pulse, or the aortic pulse for 60 seconds. Okay? The aortic pulse is about 66 beats. And then that should conclude the cardiac assessment. So next we're going to move on to the peripheral vascular. So I'm just going to have you sit upright for me. Anya, can you sit upright for me? Thank you so much. And then I'm just going to have you tilt your head to your right side at a 30-degree angle so that I can inspect your jugular vein, looking for jugular venous distension, none of which is noted. Next, I'm going to palpate the carotid artery, or the carotid pulse, with 2 fingers bilaterally on both sides. Is this causing you any pain at all? Anya?
No.
Okay, she said no. Okay. And then I'm going to listen to the carotid pulse, listening for bruit with the bell side of my stethoscope bilaterally. And I'm going to have you hold your breath while I do this. Thank you so much. No bruit noted. Okay. Now that that's been done, I am going to now palpate the pulses of the body bilaterally, feeling for strength, regularity, and symmetry. So I'm going to do the radial using 2 fingers. Anya, using 2 fingers. Ulnar, brachial, femoral, which is going to be in the inner part of your thigh, popliteal, posterior tibialis, and dorsalis pedis. Okay? And then after I palpate the various different pulses, I'm going to measure the radial pulse for 30 seconds. Okay, it's about 33 beats. Within that 30 seconds, you multiply by 2 to get the full rate. And that should conclude the peripheral vascular assessment. Next, we are going to do the lung thorax. I'm going to have you sit at a high Fowler's position, which is at 90 degrees. So please sit up for me. Okay, and then I'm just going to be looking at the patient's posture. Patient is slightly slouched over, but everything seems to be symmetrical. Arnie, can you please sit up and pick up? Thank you. Symmetrical all the way across. Okay, looking for any lesions, no lesions noted. And then while I'm also looking for any bulging or retraction in the intercostal spaces, none of which I am seeing. So I'm now going to palpate the upper area of the anterior chest. Okay, and I'm palpating for any tenderness or crepitus, none of which is noted, and I'm now going to check for tactile firmitis. Can you please say 99 for me?
99.
Thank you so much. And vibrations are symmetrical bilaterally. Now that I have palpated, I am going to percuss on bilaterally. Okay, percussing for resonance. And then next I am going to auscultate. Using the diaphragm side. Okay. And I was auscultating to see if I heard any murmurs, I think. Okay, so I've now palpated, percussed, auscultated. Next, I'm going to have you turn around. On. This is time. I need you to turn around for me. Thank you. I'm going to move the hair out the way and do the same thing to the other side. I need you to sit up, sweetie. Okay? On. Sit up. Looking at the symmetry, checking the symmetry of the shoulder, the overall symmetry of the back, the posture of her back, as well as checking the skin for any lesions, as well as the skin color. Skin color is consistent with genetic background, no lesions are noted. Okay, and then next I am going to palpate the posterior area of the back. Okay, no tenderness or crepitus spell, and then I'm going to check the tactile firmitis. Please say 99 for me.
99.
I need you to hold your posture on me.
99.
Okay, thank you so much. Vibrations are equal bilaterally. And then next I am going to percuss. Okay, and resonance is equal bilaterally as well. I'm also inspecting the area for any bulging or retractions. And then next I'm going to auscultate using the diaphragm side of my stethoscope. Breathe, and I'm having her, which is also what I should have had her do earlier as well, which was breathe in and breathe out with your mouth open. So breathe in, breathe out with your mouth open. so much. Okay, and then did I ask you questions, Anya? I don't think I did. So, Anya, do you smoke cigarettes, pipes, or vapes?
No.
Okay, and have you recently experienced any shortness of breath?
No.
And do you have any history of lung disease?
No.
Okay, thank you so much. And then for the peripheral vascular, because I don't think I asked you questions about that either. Have you noticed any changes in skin conditions for the peripheral vascular, Anya?
No.
Okay. Have you noticed any sores in your arms or legs?
No.
And have you noticed any swelling in your legs?
No.
Okay, thank you so much. And now I'm gonna have you come over here to do the abdominal assessment.
Okay.
Okay, abdominal assessment is performed laying down at 0 degrees, so completely flat. And then for the abdominal, when was your last bowel movement? She said 3 days ago. Okay, thank you so much. And then have you had any difficulty swallowing recently?
No.
Have you had any changes in appetite?
No.
Okay, thank you so much. So now I'm just going to perform a visual inspection of her abdomen, looking at the skin color, noting any lesions, as well as looking at the contour of the abdomen, which is flat and slightly rounded, which is normal. It's not scaphoid or distended or overly rounded or anything. And then I am going to inspect the after inspecting that, I'm also going to be looking at the umbilicus, looking to see if it is distended, or not if it's distended, if it is inverted or everted, looking to see its position. It is midline, as well as looking to see if there are any umbilical hernias, none of which are noted. From there, after inspecting, I'm going to auscultate using my diaphragm the different sounds in all 4 quadrants, the bowel sounds. And then I'm going to use my bell and listen to the apical pulse, listening for any bruits. No bruits are noted. And then next I'm going to percuss in a zigzag motion 8 times in all 4 quadrants. Does this hurt at all? Feeling for any tympany or dullness. And then I am going to palpate using a 2-handed method to cup in 8 different areas, all in all 4 quadrants. Noting any tenderness by looking at her facial expressions. Does this hurt at all?
No.
Okay. And also feeling for any masses or organomegalies, and none of which are noted. Okay. And then I'm gonna have you sit up as well, because I forgot to do a couple of things earlier. I'm going to sit right here for me. For the, no, you can leave the chair, leave. I needed it for the way. For the lung and thorax, I need you to sit up in a half hours for me. I also need to check the 2-to-1 ratio, so 1 on the sides, 2 on the front, and she fits the anterior-posterior ratio. And then I also needed to check, I'm gonna have you stand up for me so I can show this, the chest expansion. So take a really big deep breath for me and breathe out. Thank you so much. Chest expansion is equal bilaterally. Okay, and then something else that I need to do for the is to measure the respiratory rate for 30 seconds inconspicuously. And then for her respiratory during the lung and thorax, it was clear, unlabored, and symmetrical bilaterally. And that concludes my head to toe assessment.